Glaucoma is a leading cause of blindness, but it doesn't have to be. Lorrie, Durbin, and John Lee from the Midwest Sight Foundation explain how early detection can save your vision. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU's Being Well. I'm your host, Lacey Spence, and today we are talking about a topic you do not want to overlook. It is glaucoma awareness. And joining us for that conversation, we've got two new guests to the show. Joining us from the Midwest Sight Foundation, not-for-profit, we've got Dr. John Lee and fabulous side partner in crime, Lorrie Durbin. Thank you so much for being on Being Well.
Thank you.
Now, I hear that you all have a long history together. Can you talk about how you all got connected and came up with Midwest Sight Foundation?
Glaucoma is an eye nerve disease. And it comes slowly without any pain. So most people who are affected by glaucoma do not realize that they have glaucoma. Glaucoma is also described as a silent thief of sight.
Okay.
And it affects by high pressure generally in the eye, which chokes the eye nerve. Eye nerve is connection between eyeball and back of the brain.
Okay.
So it's like a fiber optic cable. And eye pressure inside the eyeball goes high over years sometimes, and it will choke the nerve. It deprives the nerve from good blood circulation. When you don't have blood reaching any part of the body, that part is going to be damaged because the oxygen, nutrients not getting there.
Right.
So most blind people arrive at doctor's office already advanced stage when they cannot drive a car anymore, or they couldn't pass driver's test.
Sure.
It's a little late, but I had 50 years of practice, so I have seen. In my practice, practically all of them who are blind or blind, almost blind, at the time of arrival. When they enter the door, what they lost, I cannot give back. So that's when I decided I'll go back to school, and I commuted to University of Iowa, the eye department, for more training because where I live, a small city, we have more blind people than I've ever seen in other places, like Iowa City. it's a big university with a large patient population, but we do have certain areas where the genetic pool from their ancestors, and it's recorded in DNA. So they are more likely to develop when grandpa went blind. Grandkids gonna have same issue. And we have simple way to counsel them. Simple way is check the eye pressure. Normal pressure is up to 18. If it is over 20, it's suspicious. And we may do more than one check, and 2 or 3 checks can determine if that person is higher than normal. Mm-hmm. That means 22 or higher, they're better off to be 1 drop at night before they go to sleep. And this drug was not available until about 30 years ago, and it is here today. So we all are lucky to live in 2025. We have 1 drop a day drug that can, in most cases, bring pressure down to normal range. So that's what we try to do, and we have been successful. We have Middleside Foundation was established 12 years ago, and during short 1 decade, we have saved at least 120 people.
Really?
Yeah, it's a large number.
That's amazing.
And they are on drops, and they are seeing. And we go to most of Illinois and western half of Indiana. We started from central Illinois, but we are covering a large territory. With every trip we make, we generally find 2 to 5, and that is a huge number. So I'm old enough to think about so-called retirement, and I am not quitting until I get my last.
Well, and we've got Lorrie here as well,
Yeah.
who she has been with you for how long?
I've been with him for 45 years.
That is amazing. So may I ask, what is your role working in tandem with Dr. Lee and helping to facilitate these wonderful tests that Midwest Sight Foundation puts out?
Okay. Well, like I said, I've been with him for 45 years, so he got me right out of college and trained me to be an ophthalmic technologist. When my children went to college, then I went back and got my registered nurse degree and certifications. Since the practice has slowed down a little bit on purpose, we've gone out now and we do the public presentations. So with Dr. Lee, I help give the presentations. He does the counseling of the patients, or the attendees that we suspect may have higher eye pressure. But I'm also doing the eye pressure screening. So the machine that I brought here with us, this has a little tip that goes into the machine and doesn't require any anesthetic eye drops.
Okay.
It's just a quick and easy little pressure check that we can do as a person standing or sitting. No pain involved with it. It just takes a few seconds, and we get a reading of what the eye pressure is. So if the pressure is, like Dr. Lee said, over 18, then we're going to counsel them as to what their next step should be and follow with an ophthalmologist or glaucoma specialist of their choice.
This machine does not require any anesthetic, no drops in the eye. It's an amazing machine.
And portable, we love that.
Yes.
And we can't ignore the eyeball in the room. Lorrie, you've crafted this to again help educate and show people what they're looking at. How has this played a part in your education efforts, at farm progress shows and things like that?
It has been wonderful. First of all, it's eye-catching, so we get a lot of people that come to the table when we're at a show like that. But being large like that, and we're giving a presentation to a group, we can discuss the anatomy of the eye and give them the whole involvement. And the size of everything is proportional to what it should be as well. We go organizations, church groups, family reunions, because of that heredity thing that Dr. Lee mentioned. And the schools, because those children, they have that same DNA, they need to know early as well. So I've been going into the high schools and the junior highs and take the eye model with me. And give presentation. We do eye dissections, cow eyes, and that. So it's very learning experience for those children. They remember it then. Yeah.
Absolutely. And so Dr. Lee, you were talking about that there's multiple ways people can get glaucoma. It can be hereditary, or it's just different ways that pressure builds up in the eye. So if I'm somebody who I end up getting diagnosed with it, you said there's now a drop that can help lower the pressure. What other steps can I take to maybe prevent glaucoma?
The key is at least one check in the middle of life by a competent, knowledgeable doctor who, with a measurement between family history and eye pressure number, it's like a tire. If you check your tire, you will, if pressure is half the normal pressure in the tire should have 35 to 45 in passenger car. And if it is 10 or 20, something wrong with it, it's leaking.
Right.
So with eyeball is same. If the pressure is way high, say 30 or 40, that eye will not be healthy very long. And I have a situation where a young man with 5 children in the family, his profession is a truck driver. And he could not pass driver's test, CDL, his commercial driving license. So he went to several doctors. Eventually, he did end up in my office. When I checked, his pressure was high. And here's a situation that one person takes care of 5, 6 people, family, children. Now he's not going to bring his paycheck. And I know the reason. He kept saying, I want to have new glasses so I can go back to work. And I cannot give him sight. It's already gone.
Sure.
So that's when we started this foundation. We have to reach out to people. They're out there. Out of 100 people, at least 2 of them will have them. Everywhere. So that's what, when you go to a meeting with about 100 people, we see about 3 or 4 that day, one day alone. And that interprets too, here's a situation where he makes his own living and supports the family. Once he quits driving, cannot drive anymore, well, the disability in Social Security law covers people with a blindness. So that means this person is not going to pay tax. There's no income. You cannot support the federal government, and it draws. When you do that for the next 20 years, it's $1 million.
Man.
I mean, this is a real situation. Every town has the same. So Lorrie studied the public data, that is, Social Security benefit data is public information. And blindness is one of the reasons why they get the Social Security support check, which is what they need. But before that happens, we need to help them so they do not have to go on Social Security help. So with that in mind, Lorrie studied several counties, including Macon County, where we live, and Sangamon County, Champaign County, and we've been studying around our region. And she found the year we started, Macon County had a fairly high level of blindness. But now Macon County is one of the counties where the number of blind people is decreasing. So there's no question this work is helping. Champaign County leveled off. It's not going up. McLean County is about the same. And those counties around Macon County still have about the same.
Okay.
The project like this is not there.
Yeah.
So I believe that's why I said I'm not quitting. I'm going to keep going.
Well, and losing your eyesight can be scary, like you say. You mentioned losing your independence or possibly your livelihood. And you all provided me with a pair of these glasses, try to show them off here, just tiny little pinholes to help simulate your vision going. And I mean, I couldn't read a prompter from here if I wanted to. I can barely make you out. So for folks who are starting to experience these symptoms, I'm sure catching it early is the best thing you can do.
That's right.
Lorrie, can you maybe touch on this? What type of education are you getting out to people then?
The importance of the eye pressure check. Okay. The vision loss is a gradual thing, so it's over 5-10 years. It's not an immediate thing with glaucoma. So they adapt to this change in vision and may not even realize they have two eyes that are working together, and so one kind of makes up for the loss of the other one. So it isn't until they get to an advanced stage that they even realize that they have lost their vision. You can watch a person who has that and their mannerisms, they're scoping around, rather than looking straight ahead, because they're making up for that in between.
It's a gradual thief of sight, as I said earlier. When you watch people who lost sight and got only central small area they're looking through, they look like an FBI agent, they spot. They also scan and hang on to the guardrail. And these are the clues. They're already gone, they lost the sight. So before that happens, we want to help them.
Yes.
That's why we're here. They can test themselves by blindfolding. When loss of sight, they don't know what it means. I had a patient who could not find his own bathroom.
Wow.
That is the case.
Yeah.
You put blindfold and then try to find, don't fall, don't accuse me for that, and have somebody near you. But it is difficult when you guys cannot see, even familiar area like your own home. It's hard to find your own bathroom.
Sure. And that's obviously quite severe.
That's the end point. That's too far gone.
Too far gone. And so you've mentioned that we have drops that can help lower this pressure. Is there anything else we can do after we get the diagnosis?
Yes. This is a great period. Even kings and queens of yesterday will not have the tools. And first is a combination of drops or even single drop. Takes care of 90% of them.
Wow.
So that takes care of majority. And when pressure still is at a borderline or higher, we can adjust a different combination of medications. So with medication alone, I think we can take care of 95% of people. That solves about 5% of them. We can do more when medications no longer controls. And I have reason to think, and their field is decreasing. We can measure the field too. And then at that point, I consider a surgical procedure. It's fluid inside the eye can be what we call bypass, like a heart bypass surgery.
Okay.
We can leak out eye fluid through a little sac, and that sac is on the white part of the eye, and that little bubble takes care of the flow to back to normal. I have many patients, I have done that surgery, and they don't even need the drop.
Wow.
Because the surgery takes care of that. But surgery itself has some risk of infection and leakage.
Sure.
But it's not big enough to, I feel that benefit outweighs the risk. So I've done many, we call filtering procedure, which saved those patients. Many are injury related, like a snowball hitting the eyeball. That eye has slow drainage and the eye pressure goes up. And many of those eyes are unilateral. One eye has a snowball that hit, or tennis ball, any impact. Those patients we have in my town, the two young ladies I did about 20 years ago, they don't need drops. And but that's not something I would do. If the drops take care, you can wait. You don't have to go to that next stage, which is the laser. We have a laser machine. We can open up drainage channels. So there are many things now. We have a little what they call stent, which is a tiny tube. We can drain out slowly the pressure that the eyeball does not collapse. So between those new technology, there's no need for anybody to go blind. In my own care, once we found the glaucoma did not progress because they were found.
Sure. So detection. Detection is huge. It sounds like you have a massive toolbox to choose from to treat these eyes. As we're in our last few minutes here, outreach is huge to you all. You said it yourself that when you see counties that are being reached by you all, those levels go down of blindness, and reaching into new communities, I'm sure, is a big goal.
Definitely.
So how would one reach out to you all to get you to come speak and educate?
I want to thank you and the entire station here, because you have outreach. Education is another key.
Yes.
Because they have to understand, education is key to everything. Look at the world. The educated countries live better. Health is the same. So,
contact us. We would be happy to come and speak to different organizations and school programs and that. Call our Decatur number. It's 217-423-9000. Or that's probably the easiest way to get hold of us, and we'd be happy to schedule a time to come and speak and give a presentation and do our eye pressure screenings. And that's all free of charge. We're a not-for-profit organization.
It's easy to reach us. Google Midwest Sight Foundation will pop up. And there's no question that once we give talk to your town, your own town will have less number of blind people.
And they'll spread the word. And you were telling me before we set up this interview in just our last minute or so about helping pilots.
Oh,
I want my pilot seeing.
Yes, you do.
And well.
We have done the health fair screenings and given presentations at different pilot organizations. So up in Chicago, down by St. Louis, and that. And we have found a couple of pilots with high eye pressure. So, and fortunately, they've gone on to be treated. So.
Good. We want safe skies and safe flights.
Definitely.
Are you providing me a little more info?
Yeah.
We'll make sure that everybody at home gets your phone number.
That's how they can reach
email,
us.
Website. We want them to be able to see clearly and enjoy their future. Dr. John Lee, thank you so much for being here. Lorrie Durbin, thank you for being on Being Well today.
Thank you.
And we thank our viewers for joining us for this episode of Being Well. And we hope that you'll take this info to heart, get the education, and hopefully be seeing for many years to come. We'll see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln. Trusted, compassionate care.